Urinary catheters serve many distinct purposes in veterinary medicine. The proper placement of a urinary catheter in a female dog or cat poses a unique set of challenges for the veterinary professional. In this program, we will provide step-by-step details that should significantly aid you in this important procedure. Urinary catheterization is a useful procedure to perform when monitoring urine output is important for patient treatment and when a non-ambulating animal is difficult to keep clean. Examples of situations where urinary catheterization would be particularly useful include urethral surgery, urethral obstruction, acute renal failure, and paralysis. The following equipment should be prepared prior to beginning. A sterile urinary catheter. For cats, a size 3.5 French red rubber feeding tube is recommended. Larger diameter catheters should not be used because they are less flexible. When selecting a catheter for small dogs, you will need a size 5 to 8 French Foley catheter with a flexible stylet. Medium-sized breeds will need a size 8 to 12 French Foley catheter with a flexible stylet, and large-sized breeds will need a size 10 to 12 French Foley catheter with a flexible stylet. Avoid long-term placement of stiff catheters because of the increased risk of urethral and bladder wall trauma. Other materials for your setup will include a sterile water-soluble lubricants or lidocaine gel, disinfectant solution, 4x4 dry gauze, a syringe with 3 to 5 milliliters of sterile saline, sterile gloves, 2/0 or 3/0 suture with cutting needles, a needle holder, adhesive tape, a urine collection system, a clean empty fluid bag, a sterile vaginal speculum or otoscope, hair clippers, rolled up towels, an Elizabethan collar. Sedation of the patient is also likely to be necessary. Now let's look at the steps necessary in placing a female urinary catheter. To begin, place the female dog or cat in a ventral position. Place the rolled towel underneath the abdomen, cranial to the thighs. Use your clippers to clip the hair around the vulva and then surgically prepare the vulvar area as shown here. Wash your hands thoroughly and place on sterile gloves. The sterile glove wrapping may be used to place sterile items on during this procedure. Next, lubricate the urinary catheter with sterile water-soluble lubricant or lidocaine gel. Lidocaine gel will serve to lubricate as well as locally desensitize the area. Gently insert the sterile speculum or otoscope into the vulva. Locate the urethral papilla and opening. This appears as a small bump in the mucosa on the ventral surface of the vagina just before the pelvic canal. It can be seen here in this endoscopic view. Once the urethral papilla has been located, advance the catheter to the papilla and insert it into the urethral opening. Use care as not to cause unnecessary trauma to the tissue. Some people prefer to pass the urinary catheter by feel as opposed to the visual technique just described. In this technique, begin by slightly bending the tip of the Foley catheter. Gently insert your lubricated finger into the vagina. In small and medium breeds, it may be difficult to palpate the papilla. Flex and curve your finger against the ventral aspect of the vaginal passage. The curved tip of the urinary catheter should slip into the urethral opening. Occasionally, a stylet may be required to stiffen the tip of the catheter. The stylet should never pass through the distal end of the catheter, but the tip may be slightly curved with the finger to help guide it into the urethral opening. Be sure to remove the stylet as the catheter is advanced into the urethra and urinary bladder. Once urine flow through the catheter is observed, slowly distend the Foley balloon with the appropriate amount of sterile saline solution. There is usually a recommended amount labeled at the catheter connection site. If there are any signs of discomfort to the animal or resistance to injection, deflate the cuff and insert the catheter further before trying again. If a tomcat catheter is being used, advance it to the urinary bladder 1 inch past the point that urine flow was first established. Proper positioning of the tip of the urinary catheter allows free flow of urine with adequate drainage occurring and little trauma to the bladder wall. After urine flow is established, attach the urinary collection system and observe for continuous flow of urine. Apply adhesive tape in a butterfly fashion to the catheter at the vulva entry site. Suture the applied tape to the vulva as shown here. Ensure that all connections are tightly fitted and secure a portion of the drainage line of the collection system to the patient's hind limb or tail. Caring for the urinary catheter in female patients will be practiced the same as described in the previous section for males. Please refer to that section if you have any questions concerning monitoring and maintaining the urinary catheter. When removing the catheter, you will first want to deflate the cuff on the Foley catheter. Once you have cut the sutures, gently pull the urinary catheter out. Stop pulling if there is significant resistance and alert the attending veterinarian immediately. Check that the entire catheter has been removed and place the catheter on a sterile surface. The tip of the catheter can be cut with a pair of sterile scissors and placed in a red top collection tube. Your veterinarian may want to submit the catheter tip for a culture and sensitivity test, which could determine whether or not a bladder infection is present. Palpate the urinary bladder and monitor for urination every 4 to 6 hours after removal until you are confident that the animal is urinating without difficulty. While performing urinary catheterization, it is important that you communicate closely with the veterinarian. Any problems that arise during monitoring should be brought to his or her attention.